guys, so today we are talking about hepatitis C, pathology, transmission, and prevention. First person to go up is Harris. Take it away.
Okay, first we'll have a history of viral hepatitis. And hepatitis was first identified in 1989 as a principal cause of post-blood transfusion non-AB hepatitis. Shortly after discovering hepatitis C, it was found to be a cause of 90% of the non-A, non-B hepatitis infections. Chronic hepatitis provided strong evidence of leading to cirrhosis and hepatocellular carcinoma. The World Health Organization estimates that about 170 million people are infected with hepatitis C virus worldwide. Now we'll talk about the pathogenesis of hepatitis C. Hepatitis C virus enters the host through inoculation of contaminated blood products by needle injection, breakage of percutaneous barrier, or through intercourse with infected partners through any contact with blood. The virus enters the hepatocytes, the liver cells, and other susceptible cells through unique viral molecule receptors in order for endocytosis to occur and intake of the virus into the cell. The virus uncoats itself, releasing its genome, and begins translation of the polyproteins, replication of viral particles, assembly, and maturation in order to release. Every case begins with acute phase, which rarely manifests any symptoms, causing some cases to go undiagnosed and overlooked until major symptoms manifest.
Who are the hosts? Hepatitis C has a narrow host range, infecting only humans and chimpanzees. People who had blood transfusions, blood products, or organ donations before June 1992, when sensitive tests for hepatitis C were introduced for blood screening. Healthcare workers who suffer needle stick accidents, injection drug users, including those who may have used drugs once many years ago, infants born to hepatitis C infected mothers, people with high-risk sexual behavior, multiple partners, and sexually transmitted diseases, people who snort cocaine using shared equipment, people who have shared toothbrushes, razors, and other personal items with a family member that is infected. The port of entry is any blood transfusion, infected needles, sharing injectable drugs, unprotected sex, needle stick injury, mother to child transmission.
Okay, so next topic is symptoms. Now, before these manifest, there is an incubation period which ranges between 2 weeks to 6 months. Examples of these symptoms are jaundice, dark urine and clay-colored stool, fever and fatigue, decreased appetite, nausea, vomiting, abdominal pain, and joint pain. For treatment, there are two that work hand in hand, but prior to the start of these therapies, the individual should be counseled in abstaining from the consumption of alcohol. The two treatments are antiviral therapy, and this is the use of direct-acting antivirals, otherwise known as DAAs. They inhibit enzymes involved in post-translational processing and replication of HCV. It's recommended for people who are 12 years and older, and most are cured using 12 to 24-week regimens. The next is lifestyle counseling, and this is to advise in lifestyle modifications during and after therapy. You can see counseling from hepatologists, gastroenterologists, infectious disease specialists, and a nurse practitioner who focuses in liver disease. They will advise individuals in the use of OTC pain relievers, mineral and vitamin supplements, also dietary needs. Now, the big thing to take away from this, guys, is prevention is better than cure. There is no vaccine for Hep B, so the best prevention is actually to avoid high-risk behaviors that can spread the disease, two of which are injecting drugs and also just make sure that they're being very careful with their blood screening prior to transfusion. There's also universal clinical and targeted community screenings. There's treating those who are positive, so it prevents them from transmitting the disease. And also what we're doing, education prevention. So here we are learning personal protective equipment. We're learning how to don and doff them off correctly, also knowing how to properly use them. And we practice universal precaution, which is to treat all human blood and certain body fluids as though they're infectious. And infection control training, get them in 2 locations, either here at school at WOLAC with our lovely Professor K here is our picture, or in our CE courses when we renew our license.
So next is an interview I did with a person that has been living with hepatitis C. And the symptoms didn't show up till 3 years after first diagnosed. They included extreme lethargy and decreased appetite. Some of the psychological manifestations were depression, vulnerability, and fear from lack of treatment options. They were able to get treatment with Myverna, an antiviral medication that lowered the viral count so that it's not present in the blood. Although some reactivation may manifest if they're not careful, some of the lifestyle modifications were to eat healthier and eat foods that support liver function.
And that is it. Thanks for listening, guys.
Thank you, guys.
And thank you for your time.